is just reminding us about the objectives that we'd set for our discussion group today. And so the first one was around engaging discussion about sustainability and health discourses and how, so we'll talk a little bit how we've done that in DC, but we'd also like to hear about that from you, how that connects up, and that was touched on in the plenary this morning. And the second one's around what might explain it is some of the theories and strategies, and we heard earlier this question about frameworks in health and sustainability that inform campus development. So we will give a sense of what we've been doing and what's been informing our work, but it is meant to be an interactive discussion.
So Matt and I had developed a little bit of PowerPoint slides and this sort of thing. And then Matt's computer had an encounter with water, and so that all disappeared. And
Taking those water bottles, by the way, when you're back.
But it's turned out kind of interesting because after Richard Keeling's talk this morning, saying how we become sort of technology dependent in a sense and connected up, and then think, well, we've been engaged in this work for a long time, so surely we might be able to chat with you about what we're doing and exchange some ideas. So the territory we wanted to explore with you is about health and sustainability and where those agendas might intersect in our various settings in terms of health promoting college and university work or sustainable college and university work. And our particular initiative at UBC got going in 2013, where at the Vancouver campus, the Vice President of Students issued a very provocative statement saying, let's have UBC become the healthiest university in the world. And of course that got considerable attention, pro and con, but it drew people into the conversation. And then the Deputy Vice Chancellor here on this campus, and we have two very different campuses in terms of landscape, in terms of place, in terms of size, in terms of history, which creates some interesting places for conversation about people and environments. So the Deputy Vice Chancellor here said, I think we've been doing some kind of healthy campus work, so called on some of us in the area who've been engaged in this work for, well, probably Mark Duris's paper was one of the, after the Ottawa Charter, the first, that report from WHO, one of the most sort of inspirational things we encountered to say, my goodness, he and his colleagues are talking about the work we're trying to do. And that was 1998, I think. So that was fun. And so we got talking with people on this campus about the healthy campus development work we've been engaged in, community development processes, action-based research, because I come out of academia and nursing, and then went over and started working with student services in some different ways, then did some administration, so started to see things from some different points of view within the organization and realize what the different cultures are. We couldn't even talk to each other at first. Like I'd sit in a student services meeting, I didn't even know what people were talking about. And of course they wondered where I had come from. Then when we started going back and forth more between the campuses and saying, well, who's been doing this work on the Vancouver campus? It was actually the sustainability people that were doing this work. So John Robinson and some of the other folks in campus and community planning, built environments, they were the ones doing the community development kind of work, the research and operations kind of work, where the people working on maintaining the buildings, but also tending to the plants and the other species that were on the campus. Vancouver was engaging from the sustainability sector, if you will. So it was like then we said, well, okay, we need to start talking with one another. And again, at the table, trying to find common language and trying to understand one another. And it would seem simple on the surface, but when we started getting down underneath it, it was not so simple. And so then we got into a little bit of, well, I'm sure health can take care of the sustainability agenda, and the sustainability people saying, don't worry, sustainability can take care of the health agenda. And so then we said, whoa, And of course, Vancouver and Okanagan have rivalries and also tremendous complementarity.
I think they do it slightly differently, yeah.
Yeah, it's like siblings in a family, you know, it's like that sort of thing, which is a great opportunity. And so what we decided to do with the Wellbeing Initiative was to really try to create some open space, so that not just health and sustainability folks, but everybody in the campus communities, business people, visitors, students, anybody, could step into that space and say, well, here's what all this means to me. Here's what I'd like to do. Here's what I think would make the place a better place, make the campus a more exciting, healthier, happier, more sustainable place. It's difficult to keep that space open, to really have those new conversations, and to keep the learning, research, community service kinds of higher education mandates moving. And so then, and of course there are other agendas in the university that need to be tended. But then Matt and I got working together. You came in September 2014. Again, really nice, or I found it a really good partnership, because for me, coming from a nursing, healthcare provider, and then community development perspective, academe, and then you coming from sports, sustainability, very different places, and it's like, this is a good combination in terms of trying to navigate this cross-sector work and keep this space open and invite everybody in. So
yeah, and I think one of the benefits we can build off of is the groundwork that sustainability movement at UBC anyway has laid. And some of the differentiators, I think, are that they've been very successful at linking academia to operations, as you were saying. And that's hard to do, I hear, in many universities. So in some major infrastructure projects, or even integrating, for example, 600 courses at UBC have sustainability woven in, and any student can take a course with sustainability as part of the curriculum. Called Pathways to Sustainability, and that has taken years to develop a program that's been able to actually infiltrate at that level. And so we can build off with Wellbeing as well on those kinds of processes in place. Another opportunity has been around, it's not just students, it's actually the whole community. So we have staff, faculty, students, and also we have 15,000 residents on campus at UBC. We're essentially municipality that aren't necessarily affiliated. And so we the connection there, and First Nation Musqueam then live just next to us on campus and run their land, so we work closely with them and other community partners. And so for us, the opportunity is to think about how we can connect sustainability and health together, and what pieces inform. And so we've talked about health promoting things, and what we touched on this morning was the idea of regenerative sustainability. And we didn't get to dig deep, but maybe I'll just highlight 3 or 4 kind of pieces that I really draw on, and I've done a lot of work in this area as part of my thesis as well. One idea is this idea of net positive, so that came up a lot today. How can we do more good and do less bad? But there are some others. So one is the idea of really being sensitive to sense of place, and the solutions need to be designed to fit that context. And we already see the differences between 2 campuses. One size fit all does not work, so that's very important. Another one is the idea of thinking really long term. We have an opportunity as campuses to do that. We can have 20, 30, 40-year planning cycles, which allows us to be much more ambitious with what we're trying to do. One of the other things that sustainability has done is 2 years ago, had a 20-year sustainability vision signed off at Vancouver campus wide anyhow. And they've framed that around promoting human and ecological well-being in parallel. So we already have a certain link there. And the 4th one is about engaging the community to inform this process. So those were 4 pieces of regenerative sustainability, and I think I'll stop there. We just wanted to ask how that resonates, or
yeah, and just sort of parallel along with that, then the regenerative sustainability. At this campus, we were using a health community ecosystem model, actually one of Trevor Hancock's models adapted over and over again for our environment, which has got it's actually much like the sustainability egg, if any of you encounter that, where it's got a community circle, an environment circle, and an economic circle or an economy circle. Phrases like adequate prosperity, like, what does that mean? And if if you transpose and put well-being in the center rather than health alone, you can have sustainability and health in some of the outer parts and try to create some new territory. And of course, community being the people kinds of parts. Environments being, as Trevor was talking about this morning, different organizational environments, social environments, built environments, natural environments, et cetera, but holding the regenerative sustainability ideas and the healthy community ecosystem kinds of ideas, along with, say, Ottawa Charter action areas, you see some interesting intersections. Now, there's also, of course, in our way of thinking, also some unique differences and some things that, it's not like we want to merge and get everything sort of disappears into a muddy brown. But what's going to help us with some of the issues that we've got, what's going to help us move forward. So those are two theoretical frameworks that we found very interesting to talk about.
And actually I just realized the fifth one that I forgot to mention is the idea that people and environment need to be held at the same level. One should not subsume the other in terms of decision-making parties. And we say that, but actually it is really hard to keep it at that level. And some of these sort of deep green sustainability folks will argue that it should be environment first, and maybe health has got a natural or human end, and so it's quite challenging to think about position those.
And I think the other thing, it was one of the reasons we set the panel up the way we did this morning, was having a person coming from a business sector and an environmental sector, and or sort of ecological, Lael's perspective, James' perspective, and then of course we've been hearing about lots of health-oriented folks. And it's so easy to sit within your own sector and say, it is those business people that are doing it, and yet actually, if we use Richard Keeling's ideas, it's like it's us, we're the ones buying products or whatever. So it's like, what's the connectivity and how do we have those conversations instead of blaming the people who aren't in the room? Invite people into the conversation. So the other theories, so there are multiple other theories that have been informing people's work.
Let's come back to that, because we promised we'd be brief.
Okay. All right.
I'm sure
Can I
it'll come
ask
up.
a practical
Yes.
question about what you're talking about?
Yes.
And that is this notion of creating open space.
Yes.
So what I see is as we're doing all these improvements and getting ideas and more activities and more, it's project. Then you're actually creating silos, you're building silos. And so how do you kind of step back from that and open up the space for the dialogue? That includes the whole university, not student affairs, academics, operations.
Well, you think here today, like I'm really glad to see her because it's from ancillary services. And so I know that I've heard some of the work you've done, for example, fair trade kind of work on Simon Fraser University campus. And so sort of the implications of that and what that brings in that conversation. Then lots of health-oriented folks. But even just, I think with the open space, asking questions of ourselves, at least I would say for me, that I don't ordinarily ask. So what are, for example, the economic issues to be considered in this situation? What would a James Tansey say, looking at some of the ideas that I think are great? What would Lil Parrott say, for example? So that helps me keep an open space personally. But I don't know, I'd be interested in hearing what and our folks earlier, delighted to hear your experiences, talked about some of the frameworks or some of the theoretical ideas informing your work, and wondered about others. What are you finding is useful or interesting? What's happening with health and sustainability conversations on your campus? Are people in separate sectors working together, or academics and operations working together?
I'm at the Brown University, which is the middle of the prairies, and I think it was Simon Fraser University that had the Guarding Mind. Is that recipe? Yeah. So we adopted a Guarding Mind survey, which is a mental health survey that we did, but it was implemented through our HR and our president's office. But it was given to our faculty and staff and a workplace wellness initiative was put through as a result of that. But the problem that I saw, I work in student services, I'm one of the counselors, was that students were excluded from the initiative, they were excluded from the questionnaire, and they were excluded from all of it. And so it's students on our campus were in this particular initiative were seen as, well, we'll attend to that later. We have a workplace wellness issue, and we'll deal with that first. Once we get that sorted out, then we'll deal with those pesky students, and we'll look after that afterwards. So that was part of, we had to push to get student services in the discussion in the first place. But now we are, so my values as a student services person, as a counselor, and students are my focus, my only main focus, have been, so it's difficult to be on this committee and sort of see the very narrow, this is HR issue, we need to improve our attendance and our environment from an HR perspective, and so we're going to do HR things. And then the funny thing for us was that I started doing mental health first aid training on campus, and then this initiative adopted that as one of their successes, even though it was completely for and with students. And so that's part of the siloing that we have experienced as continues, right? Is because, okay, we're going to work on this workplace health and wellness initiative, but it's only for these people, because only these people are affected. And those other people, those consumers of ours, they come and go, so it's not really a big issue.
Suzanne wants to jump in.
Yeah, I want to jump in on that because I came from a student service background and joined HR and did health and wellness for HR for about 4 years. And it is a challenge because of the silos created by the financial structures of the universities. And so having rolled out questionnaires specifically for staff and faculty, and yet also trying to look at the university as a whole population and looking at it as a community and doing community development, it's really challenging because of the financial structure often. And so like the Guarding Minds at Work survey that you're actually mentioning isn't actually designed for use with students. So rolling that out to students wouldn't have been like a valuable feedback. I think you would get valuable feedback, but it wouldn't be as valid as using something that's like NCHA data. And yet, even with the assessment tools that we have, because we're not looking at community development tools, we're looking at university-specific tools. They are designed for those specific pockets of the population. And yet I've seen, and now I'm in 6 years worth of doing the work, and now I'm on the student service side of things, so I keep switching over back and forth. And yeah, it's interesting to be in part of both worlds. But one of the challenges is that it means that we have less power at the university when we maintain those silos. And so that's what I have loved about being part of the Wellbeing Initiative, honestly, meant to tout what UBC does, but is because we're trying to break down those silos. And so if you are trying to look at that breaking down of those silos, great resources at the conference is Patty Hambler, who works in the student services side of things with UBC, and she was my colleague on the other side of the fence when I worked in HR and started Thrive as a mental health initiative for all of campus, because healthier staff and faculty role model healthy behaviors for the students who are learning how to be those engineers or nurses and things like that. So we saw that we have to come at it from at least a two-pronged approach, even more.
So then you get an interesting notion. You're talking about the notion of power and what that creating alliances and more power to do things. Like if you join up together in some ways, then what perhaps can you do? And if you get the academics involved, doing the research that you need around what you're doing, then you've got that power coming in to the deal too. What do we talk about? Getting sort of the alignment where people who care about these kinds of things are lining up in some way, creating.
So, and what's interesting, I'll jump into Suzanne's position is relatively new, and it explicitly is for health physical activity promotion campus-wide, it's not just student services, and that's one of the first positions, I think, with adding the job description. And so,
Faculty,
yeah,
staff,
faculty, staff,
students, and anybody else.
Except I will say, there's a constant challenge for me to be siloed into one,
Right.
looking at
It's
one
messy,
group.
yeah, at least-
And so I'm constantly.
Or one campus.
What's your reporting mechanism like?
Well, that's the funny thing, is I am in the vice president student's office, but because of having worked with HR in the background, it's just like-minded people that I've worked with
You've got
before, so
alliances, yeah.
I'm able to jump fences that way, but I will say, it was really, the conversation started with myself and another like-minded colleague who was on the other side of the fence, who said, yeah, let's do this
Yeah.
and make this happen, and we kind of just went ahead with it, and then asked permission later.
In addition, there's also a campus-wide physical activity working group that Suzanne and I sort of manage and chair, and that represents all campus partners, including students and academics on there. And so for each of these sort of bubbles that you see, so that we so far identified, the goal is to have campus-wide working groups. That comes a little bit out of the health promoting.
It's actually,
Framework
Mark,
piece.
some of it is your framework. We started working and then bumped in the literature across one of your frameworks about working groups and task groups. So working groups where there's a topic-specific kind of
Right.
thing, like a
Right.
physical activity or mental health or the natural environment or something like this, topic-specific versus the task groups. I think we call them more cross-cutting, like say you want to have research being done or knowledge translation, knowledge development. You want to have communication or engagement. These being across, kind of supporting all of these. So yeah, physical activity being one of ours, but I know Mark's
Paula
not.
and Mark wanted to jump in.
Yes.
I just wanted to make an observation, which is it kind of goes back, no, let me make my thought. The refreshing feeling of having a president, again, and I don't want to get my structures too messed up, but
Yeah.
to have someone call us to a higher self. And I am aware that the presidents of the institutions that I have worked for, or over the time, I've only worked for two, but several different presidents, that how distant the president and the leadership feels from institutions of higher education now, and how much their job description is about asking people for money. And what happens in
Economic sustainability for the organization.
financial sustainability for the organization, because the communities that were supposed to value these things are not putting the money in. And so I guess I'm all for the sense of renegade groups and the power of relationship and things that happen, but I really truly long for someone that would say, I don't care if sustainability is over in career and protective services with the engineers who are doing health and safety over there, and you're over here in student services. I want the two of you to spend time together. So it feels to me like just to acknowledge that I do think we are in a particularly leadership deficit.
And that's the charter is the place for
Got
me
to
that
call for
I
that.
can bring it back to the campus and say,
There's
here's
call
a
for that, yeah.
template, here's a values-based template
Yeah.
that we should be paying attention to.
So Mark?
And it may go out to all the presidents. Maybe that's what we do, send it out to all the presidents.
Mhm.
Ask
Yeah,
them to respond.
a next step, a next step.
I'd say you have to be careful. We have to really mindful of the presidents and see what their strategy is. In our case, some of the phrasing was very much engagement, and now it's kind of shifting to innovation. And so you have to kind of kind of spin it.
Tomorrow will be creativity. It's the constant this and that and this and that there's not a steady light these days. And this is just my experience. Is my president is like, what's the flavor tomorrow? So
Right,
anyway.
if they change, but you gotta go with the flavor today. And the language is so
Maybe
important.
not.
And before we use the word change, and change is really seen as a negative by people. People making change is positive, but people being having to absorb the change is negative. So it's not about change, it's about innovation, moving things forward. So you have to frame it, and language is really so key. And but you got to get your values out there, and values of sustainability, values of healthy and well-being. But get them out there. And I see like UBC, they have these big lofty goals. You need these. You got to put those. They call them BHAG, big, hairy, audacious goals. You gotta put them out there, and then it gives people something to shoot for.
Yeah.
But we work a lot with the students. The students today are coming up more and more digital, native, more and more entrepreneurial, and more wanting to change the world. They're very passionate about changing the world, and more so. And you got to really latch onto that and bring them into the picture, and put them at the center of your egg, or put them as we use a triple bottom line, where and we're ancillary services, and we come from the business side. So it's not just about the money, it's about the community, and it's about sustainability. But it's really all about the student. So anyway, long story short to say, I think you got to watch the language, and you got to move things forward and innovate. And I'm a big believer in radical and disruptive as opposed to incremental. Incremental, you can wear yourselves out. That's why this big audacious goal area, you got to put that out there and kind of really and do by projects. You put things out there, try some things. Get small successes. You get credibility. And then people start latching on, and people like-minded ones will see it, and the president's going to latch on if you can tie into his.
Yeah, because you've raised a few points there on leadership and aspirational connection points. Mark, why don't you add your piece and we can come back to some of those?
I was really just gonna say that in my experience, both at my own university, but also in sharing a network of universities in the UK. I mean, it's very much been a journey, and I'm not quite sure how that relates to this idea of incremental as against kind of great big step, because I think you can have a great big hairy vision or whatever, but actually quite often, unless you're the one who's got the ultimate power, then it is going to be about finding entry points and taking incremental steps towards that vision, but always keeping hold of that big vision, which I suppose was one of the things I suggested today. But certainly, a lot of what people have said kind of resonates with UK universities' experience, in that quite often the starting point with somebody joining our network will be somebody from student services where their remit is to work with students, or somebody from HR where their remit is to work with staff, or somebody from an academic public health or health promotion department who actually sees this as an important manifestation of their work. And actually it's a journey to go from that to how, once they get the idea of whole system or systemic or comprehensive approach, of being able to weave your way through. I think, yeah, so it was really just saying that and I suppose the other thing about kind of student-led initiative, students actually leading change. Certainly in the UK we're way behind North America when it comes to fossil fuel divestment, but it's certainly been students who've led the two universities, which is actually Scottish universities, now voted for that. And I was looking on the website of what's happening here, but the students followed by faculty.
Right.
Where are you up to with fossil fuel?
The faculty just voted a few months ago 60% in favor of divesting. So that's the latest. It was very much student campaign and faculty actually, very linked together. So who've been campaigning strongly, but it's working its way through. Sorry?
What happens next?
I don't actually know.
It's a good question.
I don't know.
Some of our universities signed up with the UN protocol where we're not actually divesting, but we're voicing our opinion on boards. We're trying to make sure that the corporate boards actually change through the corporate structure as opposed to actually divesting.
Yes.
I have just something that popped up, and quite honestly, because I had a LinkedIn thing that came up and just said, "Oh, hey, new online program and this," and one of the words that came up was sustainability, online universities, and I mean, we're competing with those online universities at this point, and they really can say, well, yeah, they're pretty sustainable and they're pretty environmentally friendly because there's not they're not using a lot of fossil fuels. It's all an online focus. It's these students that are choosing to go back, whether they're adult learners or they're traditional college age learners. We are competing, and maybe this is more in the States than international. I'm not sure. That's what I'm asking. there's a competition between these universities, and in the state of Nevada, for instance, the governor just said, we're gonna start a new university because the universities in the state of Nevada are not doing a good job reaching these student populations. And I'm wondering if this is, it's really huge philosophical question thrown out there, but is that something that we need to be concerned about? Because the online universities are businesses, they are corporations, they are making money, and they are producing degrees students, and they're producing students that are then getting hired above our students who are coming to traditional collegiate campuses and universities. So, yeah.
Well, I think
Thanks, LinkedIn.
to me, that points to the need to bring in the social connectedness discussion too. It's not just about saving on carbon, it's also about creating communities and sense of place and vibrancy. And I don't know if just online does that. We have a big challenge at UBC as well, just on the number of commuting students, and also the way the law, especially the medical students, are spread around 75 or 80 locations across the province, and so
Well, I
that's a
think
good
5
example of,
campuses.
yeah.
So we talk about two big campuses, but there's actually, in terms of medicine, 5 campuses.
Yeah, across the province, and some of them are quite isolated.
Yeah.
So we-
But thinking back to sort of where we started this conversation about sustainability and health discourses, because I'm sure Suzanne's going to tell us we're down there, and how we might team up, and then sort of what, if we're thinking of theories and strategies that might be helping us. I've heard people talking about what are the different sectors or the different groups on campus, and what are their interests or agendas or the pressures of the day. I'm thinking of the presidents, for example, and or what are some of the student issues. So, you know, I guess the cross-sector part. I'm thinking of regenerative sustainability and sort of health promoting universities and colleges, and forming the alliances, starting the conversations back and forth. What about the notion of research and operations and learning, that sort of studying ourselves, standing back and looking at what we're doing. The balance, or the looking at the value of the incremental, and then when you get an opportunity to take a great leap. And then in our case, sometimes we found we were taking a fairly great leap backwards, and how then not to get discouraged, but just to say, no, we'll just start going again, you know, some of that
and the
stuff.
other big one is a community development approach, and that we're
Oh, yeah.
bottom up, and that's been written a few times. That's come very strongly, actually from our senior leadership, which has been really refreshing, that it must be bottom. So every time we get closer to articulating something with some clarity, we realize actually we need to slow down and go back out, and clarity is reminding us of this.
So your administration is saying, oh, we wanted bottom up.
Absolutely.
Well,
And our administration is saying, we're going to do this top down.
Yeah, well, let me clarify that. I would say bottom up, and also, what do we call, because we decided not to use top down and bottom up, we decided that
Everybody has something to offer.
everybody's in this, everybody has something to offer.
Yeah.
So almost taking the organizational structure, you know, where you have president and students, and then in some places it gets turned and you've got students and presidents and the in-between. What if you turn it on the side and you say, okay, we're all in this connected, thinking of Wales' world of ecological, we're all in this sort of together. And so what's the job of the president, what's the job of the student, how do you get it flowing back? I forget what the word was that we came up with.
Yeah, everything's so
Both top down
So
and
that was
bottom up.
the first two guiding principles on the back, being, and Dan, I'll let you jump into, being catalyst, enabling, connecting, facilitating, and then this idea that everybody has something to offer, inclusive community process. Those actually were heavily discussed with everyone.
Oh, she's giving us the
So,
3 minutes.
3 minutes, okay,
Where
yeah.
did this,
Who else is
And
there?
where did
then-
this come out of? How
Pardon
did
me?
this happen? How did this piece of paper happen?
It's been 2 years of all sorts of work back and forth, and again, thinking we're moving forward, and then it's like, oops, not now, and then consult with more
A
people.
lot of consultation.
Yeah, until everybody says, you know, this many people says, okay, I think we're ready to go. And then we take it the next step. So we're actually at the phase now, because we're talking whole organization change.
Yeah.
Whole system change. And so we're at the phase now, we've kind of been doing pilot work. You know, first the ideas, what did people like? Was it health or sustainability? And well-being came out as the term that seemed to create the most space that people could step into. Operations, campus planning, student services, etc. Academics, you know, it seemed like, okay, we can hang out there. And then like a little bit of pilot work, lots of people already working in this space. And then, okay, next step, how do we grow it out even more? And finally got to produce this and finally actually have a web location.
Just in time for the conference.
The conference actually helped. The conference
It
was
really
a,
did.
oh my gosh, we've invited 400
To get
people
clarity,
to campus, so maybe it's time we.
So Dana, really quickly, and then yes.
So just to comment, so I'm a staff person at UBC, I work directly with students, and I've kind of been on the periphery watching all this well-being initiative piece happen, and I think, you know, a lot of the things that have been discussed are about power, or about all the different stakeholders, and about breaking down silos, and with that whole flattening of hierarchy, that's how you create those open spaces. And so kind of bringing all of those different partners across campus together, because each one has, you know, its points of power, you know, its points of strengths. You can't, you know, without admin buy-in, you can't do anything, but without student buy-in, nothing will last. And so that's kind of been the great thing about, from what I can see as someone who's there, but not, you know, heavily involved, is that it's been a very flexible, diverse process where I even go, Matt, I don't even know what you're doing anymore, right? Now I do, but that's
When you're a
kind of,
catalyst, you get to
yeah,
sort of
it's
move
about the
and-
shifting and changing and finding those, you know, building those alliances, finding those key partners, as Suzanne was saying, in those areas. And so again, it's not necessarily about, open space doesn't silo people, it just kind of brings everyone together.
Great, okay, we're down to the wire, so
Yes, 3 points I'd like to make. Top down and bottom up. Bottom up's no good unless top down meet in the middle, as Claire suggested. The other word that is bandied about so often and has been for many years is sustainability. My background's international development, so sustainability has been a big word. My master's was about what does that actually mean. The other point that Judy made at the beginning was about the word project. The word project means a beginning and an end. The word program means that it can be extended. So that were just 3 points.
yeah, and maybe I've just given you 2 pieces for me to end off on.
Yes.
So 2 things that have worked well for us, pick up what you were saying, Dana. One is actually just the idea of having regular tune-ins with anybody who wants to come and join in. It's worked really well. So we've had 40, 50 people across that just come and share their ideas, and it's been staff, students, whoever. And that just closed the doors. That's been a huge success just on its own. They've had regularly. And the other thing is we are now leading what we're calling conversations and well-being, and it's grad student-led efforts to reach out to staff, students, faculty across both campuses to just talk about what's important and help inform. So those 2 things have been big successes. And then the last thing to your sustainability point, I totally agree, and I think that's why we're trying to dig in and talk about specifics of what we mean by sustainability or health that inform, because there are huge differences between camps that use that word, and so we just need to define that for ourselves.
And I guess for me, the other thing is that, and we've joked about this a fair bit, is that if our own well-being is not improving or at least maintaining how we're engaged in this work, then maybe we have to come back and re-examine what we're doing. Because we can get, I mean, we'd be working till midnight or 1 in the morning to prepare for the meeting the next day. It's like, how often ought a person be doing this before it's like we're not living our, we say perhaps our universities and colleges are not living true to their mission. What am I doing personally that isn't living what I'm espousing? And anyway, that's.
So one thing I heard today was Thrive. I've heard about Thrive 100 times. And it doesn't do anything for me.
Yeah.
And today it did something for me because you said it brought different people together on some common mission. I went, okay, now I get Thrive. Because frankly, Thrive didn't do it for me. So that's valuable. And I think this idea, you know, tune-ins. I mean, these are actually little promising practices that bring people together to create the open space. When you say open space, it sounds good, but you have to have the ways in.
Well, and I think also that everybody's welcome. So if somebody has an idea and they think this ought to be done or that ought to be done, we've just gotten into, well, come on in, what can you do, what do you want to contribute? It's not that I'm gonna fix your world, Matt's not gonna fix the world for all of us apparently. So how do we, it's a joint enterprise. And that sort of settles things, it seems to calm a lot of things down, because it's like, your view is valid.
And you call them
From your
wellbeing
perspective.
communities, health and wellness communities?
We have
Healthy
Wellbeing
Family
communities, but Conversations Wellbeing is what we're building out,
Yeah.
working with our partners to create new channels for two-way dialogue, and actually enabling counseling planning and all the other groups to themselves go out and capture information for whatever's relevant for them, but be able to feed that into guiding a vision, so.
So
That's
she's
on its way. So-
I'm gonna protect
Oh,
their
sorry.
well-being so they can have lunch.
Thank you.
Thank